This video looks at how you might recall your patients who have chronic diseases or who require an intervention such as an annual flu vaccine. Once you have registered the patient as having hypothyroidism, for instance, you can then find those patients and create a recall system. First thing you do is you find the thyroid patients. So here's my thyroid register. I execute this analysis to find those patients, and I find the 4 patients who have thyroid disease in the practice. I then have 2 main options which I use, and this is the one that I use all the time, which is to create an action plan for those patients. In this case, I've decided I'd like to review my thyroid patients every year. So I click on the action plan button here. I put in the item, plan of action. And I create a content there called hypothyroid annual review. I then change the date to 1 year from now, and if I decide I want to do this review every year from here on, I put it in as 1 year with, we will in this case say 10 repeats. So that will give us an action plan for that patient every year for the next 10 years on this date. That has now been done, and all of those patients have an action plan. If I get out of that, I can go and look at my action plans, and I can see that there is a hypothyroid annual review created for each of those patients. When that date arrives, those patients will, if they attend the practice, get an automatic reminder. Rather than sending out recall letters or texts, we find that we try to do most of our recall or reviews opportunistically, and then when an item goes significantly overdue, in this case it might be 6 months overdue, we will do an analysis to find those who have still not had their review done. In order to do this, if you assume that Harriet hypothyroid attends the practice, she has an action plan which is due, and I will tick this as done. Say OK, and it will then ask me if I want to repeat this a year from today or a year from the previous planned date. So it should be a year from today usually. And I say yes, and it will create another action plan for her in a year's time. We use this function all the time for our annual flu vaccinations, and sometime in November we do the analysis to find those who have not attended and then phone that group to get them to attend. We find the phoning works much better, and it's quite a small group by the middle of November as we have most of them vaccinated. An alternative method is to find your thyroid patients and send them a recall letter. So you go to your thyroid register, run that analysis, execute the selected analysis, and on that group you create a mail merge, and you pick your mergelets, and I have created one called thyroid, I think, hypothyroid recall. Open that. It will create a letter for each of the patients on your list, recalling them. So you have 4 separate letters which you just print off and send to the patients. Thank you.